When it comes to estrogen, there are 3 different types, and most people that are not trained in this field don't even know that. In medicine and pharmacy, natural means the same chemical structure that God gave you when you were born.
If hormones are done right, dosed properly, administered the right way, monitored, metabolized, excreted the right way, you really shouldn't see weight gain with hormone replacement. Welcome to The Trusted Pharmacist, where you'll learn the truth about how the body works. Welcome back. I'm Steve Hoffart, The Trusted Pharmacist, and I have a guest today that I think you are going to truly love. The topic we're going to talk about today is as hot as a hot flash. And to be honest with you, I think you'll enjoy it. Awesome to have on my good friend and mentor, Dr. Pam Smith. Dr. Pam Smith did emergency medicine for 20 plus years. She does something called personalized medicine, which we'll talk about now, that I think she is the expert. And she's also an accomplished author with 14 books, with her most recent book about breast cancer. We're going to talk about that also too. Most importantly, if you look at it in terms of my career as a pharmacist, especially learning about hormones and hormone replacement therapy, if Aretha Franklin is the queen of soul, then Pam Smith, she is the queen of hormones. And so with that further ado, I want to welcome Pam Smith to our podcast. Thank you so much for being here.
Oh, very happy to be here.
Very cool. Well, let's just jump right in as far as that goes. Just to start out, Pam, when it comes to hormones, would you say pretty much it's a guarantee every lady's going to go through menopause?
Every lady is going to go through menopause, but her hormonal journey will be unique to her.
That's a great point. And I saw a statistic right before I jumped on. 1 billion women are currently gone through menopause and are living through menopause. And you nailed it. I think that's a part. So if I was to sit next to you on an airplane, and we've talked about this before, and said, Dr. Pam Smith, what exactly do you do? Well, how would you explain what type of practitioner that you are?
I'm a personalized medicine practitioner, and really it's just what it sounds like. We provide personalized care for each and every patient because that's really where the science is here today, where everybody deserves a personalized approach, and we now can offer that to everyone.
Yeah, and that's, I think, what makes personalized root cause medicine. We look at a systems approach, and we're going to get into some of the education about why I think the healthcare system is broken in a sense, because we don't get this in school. I noticed last night we and I were talking before this. Menopause, I think, is the hot topic right now. I think it's no longer, like last night, even on the Oprah special, it said it was taboo. Why do you think all of a sudden menopause and hormone replacement and women actually taking education and stocking themselves to set themselves up for success as they age? Why do you think that's become such a hot topic all of a sudden?
I think part of it is that women are living to be older. And because of that, they really want to be healthy. They want to maintain vision, memory, and mobility. And that does require being hormonally balanced. The science, too, is really here. When I wrote my first book in 2003, it was only 73 pages long, because that's pretty much all we knew about hormones. I wrote the first edition of What You Must Know About Women's Hormones in 2010, which was half the size of the second edition, which came out in 2022, which is now this size with the references not there. And the reason for that is they don't even fit in the book. They're online. That's how much science is now here to show that hormones for women help prevent memory loss. They help with heart health. They help with bone structure. They help aesthetically. They build your immune system. I mean, there's so much that hormones do properly prescribed in what we call a physiological dose and a personalized dose for every person.
Yeah, and that's a great point. I will honestly say, anybody listening to this podcast, that's the biggest challenge for most of our patients, is that education piece. And I hate to say it, it's not just for you as the patient. It's for you to go back and talk to your doctor. And that book that Pam Smith just showed is my go-to reference. When patients come to me, I'm like, look, I really want you to read this book because I think it's so critical. But more importantly, everything in there is reference. It's got data to support it. And it's a great item to take back to your prescriber and say, hey, I know you said maybe this such and such hormone could increase my cardiovascular risk. Here's a book. I'd love for you to read that. Would you agree that's a great way to kind of go about things?
Actually, I did. And this book right here is a copy of the book that I sent to a practitioner. And we had breakfast this morning. And he gave me this back. He goes, I'm giving you this back because I have written you a personalized note in here that I had no idea all of this was available. I want you to keep it. And before I came, he asked me to bring him a signed copy. And so we kind of exchanged copies. It was so much fun because he had no idea all this was available, and he was an OBGYN.
Wow. And so along that same lines, I think a lot of comments I get on social media posts are like, I want to do this, but my doctor says hormones are dangerous. Or I brought up this to my physician and they don't even understand. How do you see, and this goes for pharmacy school, and this goes for you in medical school, and even this is medical school today, not when you and I were in school. Why do you think, like, understanding menopause or hormone replacement or all that, why do you think that's just not taught in any type of medical education, no matter what healthcare practitioner you are? Give me your thoughts on that.
Well, this is really, personalized medicine is a subspecialty. And in order to get hormones done correctly, you really do have to have them compounded by a compounding pharmacist. And they really should be prescribed by someone who has done a certification or a master's degree in personalized medicine. Unfortunately, because of oral contraceptives, otherwise known as birth control pills, everybody thinks, oh, we can just write you a prescription for any kind of hormone. We don't need to measure. It doesn't have to be personalized. Just here you are. But that's honestly not where the science is. We can personalize it for everybody. So when it comes to estrogen, there are 3 different types. And most people that are not trained in this field don't even know that. So E1 estrogen, we do not replace because it is linked to breast cancer. It is the one we make more of as we go through menopause. And I will be 71 this summer. This is my natural color of hair still. I've been on bioidentical hormones for 37 years at the perfect dose for me, which means I started with progesterone, got estrogen later. I do have breast cancer on both sides of my family. I'm not afraid to take hormones because I don't take E1. I do take E2, and estrogen has 400 functions in the body. So it's taste, touch, smell, hearing, skin tone. It lowers cholesterol, blood sugar, blood pressure, literally your memory, and so much more. Even how your skin looks and the smoothness and the softness and the pore size, all of those different things are related to what happens with estrogen in the body. But we do have to balance it with E3. E3 is the one that helps prevent breast cancer. People are always very surprised. Is this something new? It's not. The first article on E3, otherwise known as estriol, came out in JAMA, the Journal of the American Medical Association, 101 years ago. So we've known for a long time that there's another estrogen that does a lot. And recently, just a couple of months ago, a 4th estrogen was just discovered. More to come on that one.
Very cool. So you said a lot of things that got my brain going. So the first thing I'm going to ask you is, many of the hormones that are currently used in traditional practice, allopathic practice, are synthetic hormones. Can you tell me kind of what the problem with synthetic hormones in terms of competition with natural hormones and how that can really set a patient up for failure, not only when they're younger, but down the road?
Absolutely. So let's start off by defining what natural versus synthetic means. Most people think that natural means it comes from a plant. And these hormones do come from soy or yams, but that's not the definition of natural. In medicine and pharmacy, natural means the same chemical structure that God gave you when you were born. And so if it's not the same chemical structure, there's imbalances, it gives incomplete messages. In fact, when we give the wrong hormones, instead of estrogen preventing heart disease, it can actually lead to heart disease. So the good news, again, is the science is really here to look at that, but that is natural versus synthetic by definition. So the synthetic hormones commonly are E1 and E2, so not the right estrogens. They commonly are given by mouth. And we know from the medical literature that estrogen has to be placed on the skin either as a patch or as a cream, because estrogen by mouth can drive up your blood pressure. It can cause inflammation. It can cause gallstones. It lowers growth hormone, the hormone that keeps you young. It can cause inflammation. and do many other things that are not desirous. When you put it on the skin, it doesn't have any negative effects whatsoever. And so drug companies do make E2 as a patch, which is fine to use, but we still need compounded E3. Even better is just to have one cream, and that's to have compounded E2 and E3 together, which is what I personally use.
One of the questions I get all the time is, we've talked about the importance of hormones. Is hormone replacement, you think, critical for every lady? Or I get the thing all the time is like, I'm 80 years old, like I shouldn't take hormones. I think we know hormones given early are more important, especially as soon as we see those hormone levels drop off. But tell me your thoughts on how important it is for ladies to be on hormone if they're a candidate. I heard something at a talk one time and I really appreciated this. It's almost, we don't give informed consent. It's almost, when it comes to hormones, we want to talk and almost give informed refusal. And I heard that. It's kind of an interesting thing because we do know the benefit. Give me your thoughts on that.
Well, first of all, we do get more benefit from hormones, particularly estrogen, if it is given when the estrogen first goes down. But not all women lose estrogen when they stop cycling. But particularly if the person is overweight, estrogen is stored in fat cells. So my best friend died at 72. She did not lose estrogen her whole entire life because she weighed 300 pounds. But the studies do show that whenever you lose estrogen, the best thing to do is to start it, because in the first 10 years, it has more bone, heart, and brain protection. That, however, does not mean if you started at 80, it doesn't have some bone, heart, and brain protection. So is it okay to start someone at 83 years of age on hormones if they've never been on it and they are a candidate for them? Absolutely. I always tell people, when it comes to how long should you take them, when you put me in that little pine box, my hormones are going with me.
Gotcha. I mean, I think if anybody knows the value of hormones, Pam, it's you. And for you to be this hardcore understanding the need for them, it doesn't take a lot of convincing to me to know the importance. One of the unique things that I saw on a special that I saw last night was something about, believe it or not, symptoms of menopause can begin at age 35. And I'm like, well, duh, because that's right about the time your progesterone levels start to gradually start declining and we start seeing those erratic things. Are you starting to see issues? It brought up too last night, more and more ladies are going into perimenopause earlier and going into earlier menopause. What are you seeing, or what do you think might be the cause of people going into menopause earlier and earlier?
Well, first of all, normal menopause right now is ages 35 to 55. But many women have symptoms 3 or 4 or 5 years before they go through menopause. So yes, you can be 30 and be perimenopausal, but we are starting to see hormonal changes in general at younger ages. So we are now starting to see women cycle when they're 9. The average age when I was in medical school to start your cycles was 12.5 years. So even that has started to be earlier. Going through menopause has become earlier as well. Most scientists believe that is related to toxins. There are different kinds of things like BPAs and phthalates that really are endocrine disruptors. So they change the endocrine or hormonal system in your body. And because there's so many toxins now, we do believe that is the number one reason why people may have hormonal dysfunction throughout their whole life.
Yeah, and that's a great point, because I do think that's it. And an average lady for menopause, let's say at the beginning, perimenopause, when the hormones begin to get out of balance to when basically a lady stops having cycles and goes to menopause, what do you see the average length of time that is for most ladies?
It can be up to 5 years, particularly in thinner women, because thin women do not store things like estrogen. So they do have more hot flashes and they have a harder time with perimenopause to begin with. But having said that, it's all about balance. So the balancing hormone to estrogen is progesterone. And you can be low on progesterone at any age, PMS, PCOS, PMDD, perimenopause, menopause, endometriosis. They're all low progesterone states. And progesterone balances estrogen to stop you from getting breast cancer. It also helps with anxiety, irritability, insomnia, mood swings, depression, heart racing, bladder problems, and gut disturbances. But that's the natural form progesterone. The synthetic progestin actually doesn't do any of those things and may cause inflammation in the body instead of decreasing it.
And Pam, I think you might have touched on something. That word progestin, which was what was in Women's Health Initiative study, is what started this whole disastrous track into, oh my gosh, we can't take hormones because they cause so many problems. And I think if that maybe one thing alone would have been clarified or fixed in the Women's Health Initiative study, I don't think we'd maybe be where we're at today. You kind of feel the same way?
Oh, I absolutely do. In fact, some journals are fascinating. You read the abstract, and for those of you out there who don't know what an abstract is, it's a summary of a journal article. And when you read the summary, many times it will say progesterone, the natural form, which in actuality, when you pull the trial itself, they use a synthetic progestin. So sometimes in science, they don't even get it correct.
So we've talked about estrogen. We've talked about progesterone. There's this secret hormone that has to do with more than sex drive and libido. And what is that magic hormone that some ladies also need? And I think you said about 50% of ladies could actually benefit from this hormone.
Absolutely. It's called testosterone. First of all, not all women lose testosterone with age. I personally don't take testosterone because I still have it. So we only give you the hormones that you need. Testosterone is more of a sexual interest. It is your strength of bone. It also builds bone. It has to do with your memory being sharp. It gives you energy and muscle mass and self-confidence and all those wonderful things as well.
Very cool. So that's a real rounded thing. And you've said before, your hormones are like a symphony and they all have to play together to get the best outcomes. And that's what makes, I think, personalized medicine really what it's all about. Along those same lines, we kind of talk about hormone replacement. So hormone replacement, I think, is one piece of that puzzle, a very big piece. What are the other big things that for a lady that's going through menopause, what are the other things that she needs to really focus on to make sure that she gets the best outcomes and the best success as she gets older?
Well, it does have to do with decreasing inflammation. A little bit of inflammation heals. Too much causes almost every disease that you can think of. So estrogen, progesterone, testosterone, DHEA, cortisol, pregnenolone, melatonin are all anti-inflammatory. But where do we start with decreasing inflammation? We start with how you eat. People always ask, what should you eat? How should you eat? Really, the Mediterranean diet is perfect because it is anti-inflammatory. And that's what we're trying to do. And so many of the symptoms now are related to inflammation and so many of the diseases in the body. So that's the very first thing. Exercise is key. It's not something I particularly like doing, but they did a great clinical trial showing that square dancing and other kinds of dancing are actually exercise. So for me, that's great. That's grand. Find a method of exercise that you want to do that is great because it helps maintain memory. It helps get the toxins out of your body as well. In the balancing of the hormones, the female hormones we talked about, but there is that balancing of DHEA and cortisol, the hormones made in the adrenal glands. DHEA does make estrogen and testosterone, and it balances cortisol, your stress hormone. You have to have cortisol to live. If you do not have it, you die literally in 1 week. So it is the most important hormone, and we want it to be dead center of normal on the saliva test. And we're going to talk about testing shortly, but it needs to be dead center of normal. So you have to have cortisol. Too high is problematic, too low is problematic, because either way can cause your blood sugar, blood pressure, cholesterol to go up, your thyroid, which is the conductor of the hormonal symphony, not to work as well. You can put on weight, etc. So that's kind of the rounding out of the other hormones. But there is a master hormone called pregnenolone. Unfortunately, it's hard to say and hard to spell. It is Pregnenolone. Pregnenolone, pregnenolone. It is your hormone of memory, decreases inflammation, and it does make all the other hormones, the estrogen, progesterone, testosterone, DHEA, and cortisol. That one is measured by blood. The level has to be 55 to maintain memory. So the lab may say 44 is okay if you're 71. It's okay if you're 71, but it doesn't maintain memory. I don't take pregnenolone because my level is still 55, so I don't need that hormone. Again, we only give you the ones that you need. The rest of the hormones are best measured by saliva. So if it's okay with you, Steve, we'll take a second to talk about measurement. So you can measure hormones by blood, otherwise known as a serum. But if the hormones are put on the skin, they do not show up in the blood. They're what's called lipophilic, meaning they go into the tissues really, really fast. It only takes testosterone 12 minutes to go into the tissues. So if you put it on the skin, it really does not show up in the blood and people get overdosed. Estrogen and testosterone have to go on the skin. Salivary is the best because cortisol has to be measured by salivary testing. That is the gold standard. We want the bioavailable hormone, the hormone available for the body to use. For progesterone, the only way to get that is to do a saliva test. And on the saliva test, we see the ratio of estrogen and progesterone and the ratio of DHEA and cortisol. Some people say, oh, measure by urine. Urine is really important because it looks at the breakdown products of estrogen, and making those breakdown products perfect decreases the risk of breast cancer. But we don't dose off of urine because it's a breakdown product. It's not the direct measurement of the hormone itself. So hormones are put on the skin, have to do salivary testing. We don't want to dose off of urine because it's a breakdown product and not the direct measurement of the hormone itself.
So Pam, I love your explanation of testing because I think that is so critical because that's one of the most common questions I get as a pharmacist is, and you mentioned it's all about balance and symptoms are like part of what we have to do. And unfortunately, when it comes to hormone replacement, I think that's what most doctors are just taught is we test off and we treat off of symptoms. But you know as well as me, there's no way you could be personalized and create the exact dose for that patient without testing. So I like that explanation. That's excellent as far as that goes. One kind of last topic that I want to ask you about is like menopausal women and weight loss. Like that's like vinegar and water or like, you know, like water and oil or vinegar and oil, whatever you want to say. Like they just don't mix. Like I see so many ladies that do all these things perfect during menopause and just can't lose weight. They so struggle with that. And I know they get so frustrated. And this is this explosion of GLP-1s and all this kind of stuff right now. What do you think? What do you think's in your mind the biggest challenge for ladies during menopause related to weight loss?
Well, the average weight gain at menopause is 20 pounds if you don't go back and balance the hormones. You don't really have to gain 20 pounds. I deliberately gained 4 pounds because your wrinkles show if you're really, really skinny. So you want to be a healthy looking weight. And so part of the reason is that estrogen regulates your blood sugar, as does progesterone, as does testosterone, as does DHEA, as does looking at cortisol. So if those hormones are out of balance, then insulin, the ability to regulate your blood sugar, doesn't work very well. And that's how GLP-1s work. So just balancing your hormones goes a long way in order to help you be the weight that you want to be.
So would you agree, and I hear this all the time, if hormones are done right, dosed properly, administered the right way, monitored, metabolized, excreted the right way, you really shouldn't see weight gain with hormone replacement, correct?
You should not. The number one reason why there's weight gain when it comes to hormone replacement is an imbalance of hormones. The other thing I should mention is toxins. Toxins can cause a problem with weight gain. That's becoming much more common. Really, over the years, we've always known there's been toxins of metabolites, of metals, etc. But since about, probably 7 or 8 years ago, we started seeing a bigger issue with all kinds of toxins. And so now we do what's called TPE, therapeutic plasma exchange. That's something that you're about to offer at your pharmacy. And so check it out with Steve. It's something new, really dynamic that will help you be really healthy for memory and heart disease and weight and autoimmune diseases and infections like Lyme and long haul COVID and all kinds of things. There's some new things on the horizon. TPE has been around for 50 years. Having been an ER doc, we used it in the ER to get rid of toxins before there was Narcan for drug overdoses. But now we can use it in a special new way to help balance the body and get rid of those toxins. In fact, there's even some women that can't take hormones until we get the toxins off, and then the immune system comes back into balance and we can give them hormones.
That's awesome. And you create that up. This kind of ties into it, kind of one of our last wrap-up questions. So you just wrote a book, how to prevent breast cancer. And that obviously ties into toxins too. But guys, with all your books, you do a tremendous amount of research. They're all referenced. And so all the data is there. If you had like one or two little nuggets that maybe you learned while doing research for the breast cancer book, what would those be, Pam?
Well, actually in the book, there's what's called non-modifiable, meaning things that you're born with that you really can't fix, risk factors for breast cancer. And then there's modifiable risk factors, things that you can fix. And the book goes through a list of both of them, and each chapter shows you how to fix them. Probably the most important one, and the hardest one for me, is sugar. I like chocolate. I like other sugars. My favorite sweet is pecan pie. My mom was born in Tennessee. What can I say? And so I have to really watch it with the sugars because, sugar feeds cancer cells. So for a tip, it doesn't mean don't eat it. It just means be judicious on how you're doing it.
Very good. So just one wrap-up question, with all your clinical expertise and your knowledge and your patient encounters and what, I would say we learn as much from our patients sometimes as much as we impart. If you had to go back and do it all again, what's the one thing you would change in your own health journey that you think could have the biggest impact on your health?
I absolutely would have started exercising sooner than I did because it's not my favorite thing to do. I really wish I had started down that road. I do exercise on a regular basis and I'm very, very good at it. But the science wasn't here to really make me understand that if I want to maintain my memory and be really healthy, I needed exercise. So that would be the one I would change.
That is awesome. You brought so many valuable things today. Our conversation, I think more importantly, it empowers patients to take control of their health. That's what this whole podcast is about. And you would agree with me, I'm sure, that educated patient is the best patient for us to work with, because if they can help themselves while we're helping them, we are much more successful. And you brought so many wonderful things today. Pam, if people wanted to try to find you and look you up somewhere or find your information or find your books, what's your suggestion there?
Actually, you can go, if you want to find my books, you can always go to my publisher, Square One Publishing. They're in New York City and they have carried all my books. So you can always go to their website and order it on Amazon. You can go to bookstores and purchase it as well. And you can go to drpamelaSmith.com. So any and all of the above.
So Pam, like I said, you are a wealth of information. Do you just have any kind of parting shots or anything you want to show us before you head out?
Absolutely. This is my brand new book, How to Prevent Breast Cancer Before and After. So even if you've had breast cancer, it will give you tips as well. Thank you so much. I've really enjoyed being a guest on your podcast.
Thank you so much for joining us today. Have a good one.